Cancer is a disease in which cells in the body grow out of control. Cancer can be hard to talk about, but there are screening tests available that check for certain cancers. A screening test is used to look for a disease when a person does not have any warning signs. Often screening can find cancer early when it is most treatable and sometimes even preventable. This video will discuss screening guidelines and tests for 3 types of cancer. Colorectal cancer is cancer of the colon or rectum. The colon is the large intestine or large bowel. The rectum is the passageway that connects the colon to the opening to the outside. Both men and women can get colorectal cancer. It is most often found in people 50 or older. The risk of colon cancer increases with age. You should begin screening for colorectal cancer soon after turning 50. Some people may be at higher risk because of family history of colorectal cancer, bowel disease, or genetic disorders. Talk to your doctor about when to begin screening and how often you should be tested. There are several different screening tests that can be used to find polyps or colorectal cancer. Polyps are a growth that shouldn't be there. Some polyps can turn into cancer, but it usually takes several years for this. Screening tests can find polyps so they can be removed before they turn into cancer. Sometimes more than one of these tests is done. Fecal immunochemical test, FIT, uses antibodies to detect blood in the stool. Your doctor will give you a test kit. At home, you use a stick or brush to obtain a small amount of stool. You return the test to the doctor or lab. The stool samples are then checked for blood. This test is done every year. If blood is found, more testing, such as a colonoscopy, should be done. Flexible sigmoidoscopy is a test done by the doctor. The doctor puts a short, thin, flexible lighted tube into your rectum. The doctor checks for polyps or cancer inside the rectum and the lower part of the colon. This test is done every 3 to 5 years. Colonoscopy is similar to sigmoidoscopy, but the doctor uses a longer, thin, flexible lighted tube to check for polyps or cancer inside the rectum and the entire colon. During the test, the doctor can find and remove most polyps and some cancers. When cancer starts in the breast, it is called breast cancer. All women are at risk for breast cancer. Men can also get breast cancer, but this is rare. Breast self-exams, BSEs, help you get to know the normal look and feel of your breast. You don't have to feel as if you're looking for signs of trouble. Just get to know your breasts. That way you'll be able to recognize changes if they happen. Along with BSEs, a clinical breast exam can help catch breast cancer in the early stages before a woman even notices symptoms. This exam is like a self-exam, but it is done by your doctor. This is usually part of your yearly exam. A mammogram is an X-ray of the inside of your breast, which can show changes too small for you to feel. Your breast is gently squeezed between 2 plates to get a good picture. This only takes a few seconds, and for most women, causes only mild discomfort. If you are 40 or older, you should have a screening mammogram every 1 to 2 years as recommended by your doctor. Women under 40 with either a family history of breast cancer or other concerns about their personal risk should talk to their doctor about when to begin mammography. Cervical cancer is the easiest female cancer to prevent with regular screening tests and follow-up. 2 screening tests can help prevent cervical cancer or find it early. A pap smear is a test that checks the cells of the cervix, the opening of the uterus, for changes that could lead to cancer. It is one of the most reliable and effective cancer screening tests available. During a pelvic exam, the doctor collects some cells from the cervix with a swab. It is usually not painful and only takes a few minutes. The cells are placed on a slide or in a bottle of liquid and sent to a lab. The lab will check to be sure that the cells are normal. The results are sent from the lab to your doctor, who will contact you if your pap smear is not normal. The HPV test looks for the virus, human papillomavirus, that can cause cervical cell changes. If you are getting the HPV test in addition to the pap smear, the cells collected during the pap smear will be tested for HPV at the lab. You should start getting regular pap smears at age 21. or within 3 years of the first time you have sex, whichever happens first. Most women need to have a pap smear every other year. Talk to your doctor about your individual situation. If you have low income or do not have insurance, you may be able to get help paying for these screening tests. To learn more, ask your clinic staff or call 1-800-738-2301.